welcome back to HWLRADIO.com. It's your main man Hollywood, and I'm back with some more news you can use, especially if you on Medicaid, because half of U.S. doctors no longer accept Medicaid. And here goes the story. Under Obamacare, you may have a right to get health care, but with increasing numbers of physicians not taking new Medicaid patients, good luck finding a doctor if you happen to be a low-income patient. A recent survey of the medical profession found that fewer than half, 45.7% of physicians surveyed, are willing to accept new Medicaid patients, notes Joshua D. Gaston, a member of the Young Leaders Program at the Heritage Foundation. The survey by the physician search and consulting firm Merritt Hawkins found the overall rate of acceptance of Medicaid as a form of payment in 5 medical specialties across 15 metro markets is 45.7%. Boston was the highest at 73% and Dallas the lowest at 23%. Medicaid patients and patients with private insurance often seek convenient care in hospital emergency departments when they cannot access office-based physicians in a timely manner, the study found. The problem of physicians' access could become more pronounced as millions of previously uninsured patients obtain coverage through the Affordable Care Act, said Mark Smith, president of Merritt Hawkins. In April, the Congressional Budget Office estimated 7 million people will be added to the Medicaid program this year. By further expanding this broken program, Medicaid, Obamacare will only exacerbate the situation, continuing to harm many low-income Americans who have no option other than Medicaid, he said. Philip Miller, Vice President for Communications for Merritt Hawkins in Irving, Texas, confirmed to WND that low-income people on Medicaid will do a lot more standing in line to get medical care. Low-income people are going to end up being pushed more and more into hospital emergency rooms for more accessible care, and they will go to community health care services that treat indigent populations, he said, but mostly is going to be standing in line a lot more to get medical care. Miller contends that the way medical care is delivered to indigent or impoverished people will have to change. We need to utilize more widely non-physician health care providers to include more physician assistants, nurse practitioners, and other types of clinicians who can do some of the types of things that doctors do, he said. The long-term solution, he said, is training more doctors and improving the economy. We have a shortage of doctors, he said, and really it ties into the broader issue of economic opportunity. We have to improve the economy and get more people jobs so that they have the money to afford health care. Miller acknowledged that health care is rationed one way or another, and increasingly it is going to be rationed by accessibility to health care services, including the physical ability to see a doctor. Many doctors can only sustain so many Medicaid patients because those patients are less well-paying, and a physician, at least in a traditional private practice, has to make some money to keep the doors open, he said. So physicians in private practice can only see so many indigent and uninsured patients. It will definitely be a challenge. Robert Moffitt, Senior Fellow for Health Policy Studies at the Heritage Foundation, said Merritt Hawkins' study is the latest report in a series of studies that have shown fewer physicians are willing to accept Medicaid patients. Medicare may give you the right to health care, but it doesn't mean you can find a doctor, he said. Moffitt noted that along with the problem of increasingly crowded emergency rooms, the medical profession has become disenchanted with the Medicaid program because Medicaid has very low reimbursements even compared to Medicare, and much more red tape. He explained that Medicaid is actually 50 different programs that are jointly financed by the federal government and the state government. Each state administrates its own version of Medicaid, complicating administration of the program on a nationwide basis. Moffitt pointed out that Medicaid reimbursements are much lower than private health insurance and routinely lower than Medicare. Another problem is that while providing much higher reimbursement, private plans also require much less red tape. The people who don't have access to a doctor because they can't find a doctor who's going to take Medicaid reimbursement may end up in medical clinics if they are are lucky. He said, but the clinics may not take them because every time a Medicaid patient walks into a clinic door, the clinic loses money. He concluded Medicaid is no longer a reliable insurance option for low-income people, especially for people who are sick. If you are ill, especially if you have a chronic disease, you need consistent access to a physician who can monitor your condition, he noted. Moffitt said the Medicaid expansion that is being engineered through Obamacare is counterproductive national policy because it does undercut access to physicians for indigent. Expansions of Medicaid does not mean expansions of access to Medicare, he said. So, here's the bigger problem. Medicaid ain't really gonna mean nothing in a few years. So, they fighting to make it mean something right now. But as you can see, doctors are losing. And if you had a company and somebody came in and you accepted Medicare, but every time you accepted Medicare, you lose. And if your company is swamped by 80% Medicaid, then you taking the 80% punch and gaining profits. And that's what's going on with these doctors and physicians and these private-owned doctors, which normally are the best ones because they done branched off and got their own damn company. So my whole thing is, motherfuckers need to start working together. Because you're going to need health. You're going to need all that shit. But if they keep on pressing the agenda of tearing families apart, then you're going to be in bigger trouble than you thought you were when you heard this damn story that I brought to you today. So, yeah, motherfuckers better start thinking of a way to work together as the minority, because guess what? The millionaires and billionaires, they finding out a way to work together to keep afloat. So you better find out a way to work together to keep afloat. And that just ain't in your household. That's with your neighbors. That's with everybody that's in your living level. So y'all better learn to work together, because it's the only way that we gonna make it. Because they gonna make it. They gonna make the motherfucking bill, the plan, or whatever to benefit them. So you make sure you working to benefit you. But that's gonna be the show for today. So go over to HWLRADIO.com, download the radio station app. Make sure you check out the sponsors page. And shit, I'm out and shit.